So I've been assigned to talk about heart failure in my little video here. So what I'm going to do is show you guys this cool anatomy of heart failure video that I found. And I'll just kind of narrate you through it. So the deoxygenated blood enters through the vena cava into the right atrium, where it goes through the bicuspid valve into the right ventricle, out to the lungs and back into the left atrium, and through the mitral valve through the left ventricle, and that's going to go to the body. So on the left side you have oxygenated blood coming back from the lungs, and the right side is deoxygenated blood coming back from the body that's used that oxygen up. So in heart failure, one of these four areas of the heart are going to stop working or start working incorrectly, causing a varying amount of symptoms. If the heart can't push the blood back out to the body, you're going to have a decreased cardiac output. With left-sided heart failure, the left side of the heart does not deliver enough oxygen-rich blood to the body. That's going to cause symptoms such as fatigue and shortness of breath upon exertion. And that's also going to cause the blood pressure between your lungs and left ventricle to go up. And that's going to take your fluid and force it out of the blood right into the lung. And that's going to cause the shortness of breath. With right-sided heart failure, it's the right side that's not able to contract with enough force to push the blood through. And that's going to be going through to the lungs, so it's going to build up the blood in the veins. And it's going to cause a buildup of fluid, which could cause symptoms like swelling and edema. So all in all, you've got less blood being delivered to the body. That's when your nervous system is going to release the stress hormones that are going to start speeding up the heart. But that's actually going to cause long-term muscle damage. The most common cause of heart failure is CAD, or coronary artery disease. Some other causes can include high blood pressure, diabetes, diseased, infected, or damaged heart valves, disease, infected, or damaged heart muscles, irregular heartbeats or arrhythmias, and heart defects. We also have poisons or substance abuse and lung disease. Sleep apnea can also cause this issue. In extreme heart failure, you're going to need surgery or a heartbeat assisting device such as a pacemaker. You may be prescribed ACE inhibitors, which allow the blood vessels to expand and decrease the blood pressure. And you may be prescribed a diuretic if you have excess fluid, and that'll help get rid of that fluid. Beta blockers are also commonly prescribed. They slow down the heartbeat and they protect the muscle from long-term damage. The doctor is probably going to have you start exercising regularly. They're going to have you maintain a healthy weight, quit smoking, you'll limit your salt and alcohol intake, and you'll start eating a heart-healthy diet. The surgeries that we do to treat this are coronary artery bypass graft, heart valve reconstruction, and left ventricle reconstruction. And these all basically just remove damaged heart muscle. You can also have an implanted ventricular assist device, which helps the heart pump the blood. You can have a heart transplant, which is just a total replacement of your heart from another human heart. So basically, heart failure is when you're failing to get oxygenated blood to the body in all systems in a correct amount of time. With left-sided heart failure, you're often going to develop right-sided heart failure if it's untreated. And left-sided heart failure usually is going to affect your lungs first, because that blood is backing back up into your lungs. It's going to cause coughing and vein distension and all of that. So the first signs and symptoms you're going to see in the patient with left-sided heart failure is most likely shortness of breath and fluid in the lungs.